And welcome back to Comcast Newsmakers. I'm Steve Swat. My guest this segment is Dr. Marilyn Hopkins, who is the Chief Operating Officer and also the Provost at Touro University in Vallejo. Thanks very much for being with us.
My pleasure.
And I guess Touro, along with some other schools, I guess they're not your father's medical school. Isn't that safe to say? I mean, it's a different model, isn't it?
Well, we're a private nonprofit institution that's part of the Touro system, so which right now operates 4 medical schools. So our particular campus on Mare Island was the first of those 4 programs. So it's a relatively young program. We offer a Doctor of Osteopathy degree and are doing very well. We're very excited to be in California.
We have an issue in California, I guess nationally, really, of trying to turn out enough medical professionals to handle the growing needs of an aging population.
Yeah.
And that's, I guess, where you fit in, right?
Yeah, absolutely. Our campus in California, Northern California, offers all graduate degrees. So we have a College of Osteopathic Medicine, College of Pharmacy, and then we have a College of Education and Health Sciences, which offers a physician assistant program as well as master's degrees in public health and education.
How severe would you characterize the shortage of medical professionals right now?
Well, it's very significant. Now, I will say my past life, many years ago, I was also a nursing educator. And although Touro doesn't have a nursing program right now in Vallejo, that's something I'm real close to. The recession is impacted in careers like nursing, the shortage in the very short term because of the impact of the recession. We've had a lot of nurses come out of retirement and change some of their plans because of economics within their family. But the shortages are very real, and particularly for physicians and what we call mid-level providers, which are physician assistants and nurse practitioners in rural areas, in areas which provide services to underserved communities. But truthfully, with the Affordable Care Act, we're expecting to have serious shortages in all those areas just because of the increased volume of patients that are going to be coming into the system. So that's good news because we want those people to have health care. But unless we really ramp up the education and the production of those health professionals, who's going to see them?
Well, it's obvious. I mean, in California, the University of California, various, whether it's Davis or UC San Francisco or UCLA, for example, can only do so much. Stanford can only turn out so many, and some of the other private schools. So I guess the question is, you admit 135 or so every year. Why don't you admit more?
Yeah, no, I get asked that all the time. Obviously, accrediting organizations are very powerful and important groups because they help to ensure the quality of the educational programs, in this case in medicine. And we cannot grow our program larger, for example, until we can develop a residency program. So in medicine, you're talking about someone who has a bachelor's degree and then graduates from 4 years of medical school. But the next step in terms of their graduate education is to go on for a residency. That's an additional 3, sometimes 4 years. And it's very, very important to provide that opportunity. So for us, for example, until we can have a hospital partner or a corporate partner in healthcare who will offer a residency program, we're frozen at our current size. And unlike UC Davis or UC San Francisco, we don't have a hospital on site.
Right.
So we have to depend on community partners.
You talked about accrediting. Industry-wide, every once in a while you hear about some schools that run afoul of the accrediting agencies. And that's I guess a potential problem. I mean,
it's an image problem.
An image problem, isn't it?
Yeah, it's the kind of problem that would turn a provost's hair white.
Yes.
So no, all our programs are fully accredited, and we're very proud of that. That's, in our opinion, essential. So whether you're talking pharmacy, physician assistant studies, or osteopathic medicine, we value that professional accreditation.
All right. Well, we're out of time, but Dr. Hopkins, thanks for coming by and talking about Touro University and really the overall healthcare situation and environment. We appreciate it.
Good.
And thanks to our viewers, of course, also for watching Comcast Newsmakers. We'll see you next time.